All right, I'm going to be going over key terms: endemic, epidemic, pandemic, notifiable diseases, and Epi Curve. When you think of these terms, endemic is a disease that occurs regularly in a population. This means that it is something that you will see commonly. It is something that has a baseline. For example, the flu is endemic to many regions. Epidemic is a disease that occurs above the normal level. And when you think about an epidemic, this is something that can have very low case numbers, and it can actually be an outbreak that occurs. And so outbreaks are synonymous with epidemic. When you have a disease that is occurring above what you usually see, that is an epidemic. Pandemic is an outbreak across a wide geographic region, and it is very synonymous with the worldwide. Pandemic is an outbreak across multiple geographic regions. An epidemiologist is a study of disease and injury trends. Actually, I got that mixed up. It's epidemiology is the study of disease and trends. And so this is someone who's studying constantly what diseases are occurring and how they're occurring and where they're occurring. And so that's why an epidemiologist is often called a disease detective. One thing I want you to be very familiar with is notifiable diseases. And so notifiable diseases go from are required by law that they be reported to the health department. So doctors, clinics, and hospitals need to report a specific list of diseases to the local health departments. And the state and health department help the local health department with the lab support, health education, case investigation. They also confirm cases. So sometimes you'll see this term unconfirmed, and they're working with the State Department to confirm these cases and working with the labs to confirm it. And this data is moving in real time to the State Health Department and to the Center for Disease Control. So sometimes you will see that the data might be different from day to day. It's because it's going from the Health Department to the State Department, and sometimes you'll see the local health department will have more up-to-date data than the State Health Department, because you'll see this is how the information flows. And one thing you need to know is that you can go to your local health department, and we'll be looking at the different diseases that are coming in. They have annual and monthly reports that they provide to the community also. So this is how the data flows on diseases, on notifiable diseases. And so the state of Oregon has a list of notifiable diseases. So this is a screenshot that I took a while back, and they have posters that they want people to put up in their clinics and hospitals and different areas, because this is required to report specific diseases in the state of Oregon. Now, each state might have a different list because there are different diseases that are endemic to specific states. And so know that when you go to a different state, they might have different notifiable diseases that need to be reported. And across the United States, we do have a list of diseases that everybody needs to report. So there's definitely a list of diseases that have to be reported. And if you look in your book in table 3.5, you'll see these are the list of notifiable diseases in 2006 for across the United States. But not every disease is considered a notifiable disease. And so flu is not considered a notifiable disease. But they're constantly looking at how flu is coming into communities to determine if there's an epidemic happening. So let's take the case of the flu to kind of look at this chart and start looking to see if there's an outbreak happening. And outbreaks are epidemics, right? And so they have thresholds. And what you'll see here is this red line is the threshold of a current year coming in. And you can see that there's an Epi curve. Epi curves are when it curves straight up, and it signifies that there's an outbreak happening, that there's an epidemic happening. So looking at this chart, you'll see that there are 4 different outbreaks, and do you notice they're following the trends of the Epi curve going up? This line right here is the baseline of what they usually see in a community. And this could differ from community to community based on what they usually see happening as a percentage of all deaths due to pneumonia and influenza. So they have their own baseline, and then they use this data. And then across the United States, they have a baseline. So here we can see the baseline, and we can see the epidemics happening and when they're happening. So everything kind of has an ebb and flow with infectious disease. This is a screenshot of the Epi Curve for Oregon. And if you click on this, actually I'll have a link to this in the module, you can see how this is going up, and I'll also provide a link in the blog too, so you can see the Epi Curve. And Epi Curves can look different at different times. So you could see over time when we've had the highest Epi Curve, and right now this is October 1st, it's very low, but if you go to today's date, you will see a different Epi Curve. So you'll see that it might be picking up again, and that is an Epi Curve. So we're constantly looking for that curve. That's not to be confused with an exponential curve where something is going up exponentially and that it's on a log scale. Don't get that confused with that. That's a whole different thing. So this is just simply case counting and looking at numbers coming in. So in review, we went over the terms endemic, epidemic, pandemic, notifiable diseases, and Epi Curve. These are terms that are often used in epidemiology and that I want you to be very familiar with.